Good morning, good afternoon, and for some of you, good evening. It is our pleasure to welcome viewers from across the globe to the final session of Motus Academy's fall webinar series. My name is Arif, and with me, I have Sarah. We will be your hosts, and we are very excited to wrap up our fall series with today's topic, putting it all together, venture capital and strategies.
Thank you, Arif. So I'm so excited to be hosting with you today as we enter into our final webinar session for the year. So we have gathered the feedback from our listeners and lined up an exciting theme this time around, where we get to hear success stories from entrepreneur come academics. So I'm extremely excited to hear from our speaker today.
Without further ado, let's welcome our speakers for today. Joining us, we have the CEO of Reactive Robotics, Dr. Alexander Koenig. Due to unforeseen circumstances, Dr. Alan Hamlet cannot be present today to share. We wish him a speedy recovery.
Yes, so it is very unfortunate not to be able to hear from Dr. Hamlet today, but we definitely hope to see him in our panel in the future. So without further delay, we shall proceed to Dr. Koenig's sharing. So just a reminder for all our listeners today, we will leave the Q&A to after the sharing session. So if you do have any questions, please type it in the Q&A box below, and we'll try our best to get it answered after.
So before we begin our session, let me introduce Dr. Koenig. So Dr. Koenig is the CEO and founder of Reactive Robotics, which carries their unique V-motion, an assistive robotic system for patient early mobilization. He received a master's in electrical engineering from the Georgia University of Technology and further received a PhD in rehabilitation engineering from ETH Zurich. His former projects relate to bio-cooperative control strategies for robot-assisted gait rehabilitation. On top of his current role as CEO, he sits on the advisory board member of a few companies, and one in particular is a judge in an exciting accelerator dedicated to startups, Alchemist Accelerator. When not working, Dr. Koenig enjoys spending time with his family in the mountains in Germany and salsa dancing. I shall pass the floor to Dr. Koenig.
Thank you very much. Pleasure to be here today. We'll speak about financing. Maybe to myself, I used to be an academic and then had the opportunity to join a startup of a friend in London. Had nothing to do with medical technology, made a lot of mistakes there and realized that I'm much better at commercializing stuff than I'm at research. And I'm happy to share with you today my learnings from the last 8 years of fundraising a medtech startup. This is a very personal observation. Of course, everyone makes their experiences. So if you have different experiences, if even there's contradictory information, let's discuss after. I want to hear about it. Already now you see my email address here on the top. Find me on LinkedIn, contact me via email if you have any questions. I was helped a lot when I started building my company, our company. So I'm more than happy to return the favor in case you are in the process of starting your own. Before going into my experience, I just want to give you an idea of who I am, who we are. Reactive was founded in 2015. Today, 7.5 years later, we're actually a still very small team. We're just 25 people, but that is because we focus very strongly on a few topics such as software engineering and quality, and outsource a lot of things. We are operational in several countries, the furthest being Australia. We're located in Germany, so that's basically once around the globe. We have all required certifications, of course, which is a prerequisite. And we've been awarded a lot of different prizes. I mention that because you will see in the funding strategy that actually is relevant for if you want to fundraise a company. As mentioned, we're in Munich. Munich, probably where you come from, you might know it. There's this little beer fest happening every year. We just finished it up a few weeks ago. So if you have a chance to stop by in Munich or visit Oktoberfest, also come see us. What do? We have developed V-motion. And we actually thought about that name for a long time. There's a lot of things in here. There's motion in here. There's emotion in there. But there's also VEM, very early mobilization. I quickly want to show you what we do, and I'm not going to make this an advertisement movie for our company. I just want you to get an understanding. We have developed this robotic system here in combination with this hospital bed. The hospital bed is important because the patient is, in our case, in critical care. So the patient might be connected to a ventilator or not be able to breathe by him or herself. The patient has probably had a lot of tubes and catheters. And now we don't want to bring the patient to the therapy, but we bring the therapy to the patient. Now, this is the robot we have developed that you will see now, that our nurse is wheeling in, brings it to the patient. She has a touch screen. She can control the entire robot from this iPhone or iPad-like touchscreen. Now she secures the patient in his or her bed. And that's very important. You see all these lines here, all these connectors here. Up here, you even see the ventilation tube. This man here, of course, is an actor. But in reality, the patients often have a tracheostomy, so that is a cut here to put a tube in to ventilate people. And someone like that, you cannot just bring them into another room to perform therapy. Now, the nurse secures the patient. She docks the robot onto the bed. We have now transformed the bed from a not so intelligent bed into an intelligent therapy device. And then she can dock the robot not only on the bed, but she can connect it to the patient. And the trick now is that we have worked with bed manufacturers and can verticalize the entire structure. We can verticalize the bed plus the patient plus the mattress, so the nurse doesn't have to lift anything. And now the robot is making the patient walk. It's more a stepping-like pattern. The robot is relevant because the patient, without the robot, just verticalizing, the patient would very quickly have a drop in blood pressure, and there could be an emergency situation. And now you see what the patient is doing here. We have developed the world's first artificial intelligence commercialized for critical care. The robot is learning what an individual patient can do and supports adaptively. So the robot is learning your patient profile. That is the result of a lot of work, I can tell you that. I'm not sure, unfortunately, I don't know where you guys are coming from, what stage you are in. Are you in an established company, or are you just building your own startup, just starting in your garage? So here is our story. Before we go to the fundraising part, I actually really started with Lego. I actually raided my own Lego box. And then, very much to the dislike of my parents, I took all the money I had and put it into starting my own company. And here it really started in a garage of a friend, and we built the first models from wood. Then with 3 employees in 2016, first investments obtained, could build a metal-like structure. The system still exists. And then over the years, we iterated ourselves to a point where we had from prototype to product, really a system that would not only be CE certifiable, but would be a product. Why is that important? Because of this. This is a very busy slide, and we'll spend a little time on it now. This, I would say 99% of all medical technology companies follow the following path of value inflection points. And now we are in the dead center of fundraising. A value inflection point, I hope you know, is a point where the company value suddenly from one moment to the other jumps. And company values typically, at least in medical technology, don't increase linearly, but you have an idea. And you bring this idea to a first prototype. And that's typically when your company valuation jumps by a factor of 10. Each of these value inflection points typically make your company worth 10-fold its previous value. Then the next value inflection point is typically that you receive certification. And here's the interesting point. After you have certified your product, only then will you make it an actual product. What do I mean with that? The difference between your CE certified device, which is you can bring into the market, and an actual product is that the actual product does not break, does not have problems does not generate issues. And this fact that you have actually had your system in the market for several years, you really have found all the little nitty-gritty edge cases in which your system might not work perfectly. The moment when you bring it from something that does what you want it to do to something that actually does it at any time, and it is serviceable, it is reliable, that is where, again, your company value typically jumps. And now, looking at this passage, the average company typically needs 5 to 6 years to reach this point. Why is that relevant? You need 4 to 5 years typically to reach CE from the inception of the idea until you have CE. And you know that before you have CE, you're not allowed to make money. You're not allowed to sell. And that is the big differentiator between basically any other type of company. Because if you build an app or you build a product for consumers, you can still release it, even if it's minimal viable product, and can already generate money and revenue. You cannot do that in medical technology. You can, but it's not legal, so let's not do that. And now comes an interesting part, and that's something where I see a lot of engineers maybe take decisions that they later on regret. I've advised a few companies and had the honor to work with some very bright people. And oftentimes it's engineers founding a company. And they assume that once the technology is done, right, I mean, like now the technology is done, right, things gonna sell. And that's unfortunately, in most cases, wrong. I'm 100% sure there's at least 2 of you sitting there right now thinking that's not the case for my company, right? It's not valid for everyone. This is a generic most of the times chart here. Now comes the point where you need to prove your clinical case. What does that mean? It means that normally you have a clinical claim. You say, my device is making therapy X cheaper. It's making patient outcome Y better. It's making this process easier. And the problem is no one will believe you. I promise you. It's just like that, right? Just because it works on Sunday doesn't mean it's going to work on Monday. So you will have to prove that, and you have to do clinical studies, and you have to do these very, very early on. And a lot of people think that now they have the product and now it's going to sell itself. No, you need to start early with these clinical studies at some point after 7 to 9 years to have conclusive scientific published evidence that your system, your device, your technology actually does what you promised it would do. And now you come to the point even further down the road where it's business proven. That's the moment when you have reimbursement. That's when you're done, right? Typically, if you take this, each of these jumps is 10-fold increase, then you, once you have business proven, once you have reimbursement for your system, that's when you can go public, right? So typically most medical technologies companies make an exit and get sold before this point. Why is this so important? Because I think it's important to look at what funding sources there are and what they're looking for and how you can approach this. Of course, there is a myriad of other sources, but the major ones are venture capital, family offices, and public funding. Right? And the problem with venture capital is they look for a 10x in 4 years, typical. There's some that take 5 years. There's some that say we want it in 3 years. Some say we want 8x, doesn't matter. If you think back to the previous slide and you think that you're going to reach your CE certification within 5 to 6 years, then you already have a problem because these guys want to be out in 4 years, right? And interestingly, although it doesn't translate as neatly in English as it does in German venture capital is also called risk capital. And the one thing these guys hate is risk, which makes no sense, right? I mean, like, but thinking about it, it does make sense. Yes, they want to have their 10x in 4 years, but they want to make sure that the risk in reaching this goal is minimal. So what I have learned when approaching these venture capitalists, really what you want to do is you want to mitigate risk. You want to identify where's my major risk, and that's where you want to put all your work to make sure you can prove that that risk is manageable. So that I think is the most critical learning I had over the years. I would have known better. Had I known that I need to mitigate risk, I would have probably spent my time on other points. So with family offices, you have a little bit of a different picture. What they look for is, of course, a return of investment, but also to a strategic match, oftentimes, if it's the family office of a chemical family company, a family was a chemical company, or if it's a company in a field X. Oftentimes, they look for strategic matches. And oftentimes, my understanding is that family offices look for an emotional connection, right? If you have a very wealthy, high net worth individual, and that person's father had a stroke, then of course, it's much easier to connect on that level. So what I have learned, what these family offices oftentimes lack is the size so that they can really dive into your case. A professional VC has the money and has the resources to really go through your case. And here, they want to avoid of making a mistake. And that's what I said in the beginning. We've won a lot of awards. Awards are an external validation that you are not a complete idiot. And I'm sorry to say it that loudly and that bluntly, right? But if you win a few awards, then you reduce the risk of a family office to embarrass themselves by funding someone who is later on maybe doing something unfavorable to their reputation. So a trusted introduction with a few awards, that goes a long way. And then finding a strategic match, if you have a strategic investor, that goes a long way. Yes, of course, mentioning it, strategic investors are also there, but I sort of subsum them as under family offices. And then, of course, public funding. And public funding is very, very different, because these guys, the European Union, your local government, the American government, they want to keep the tech and the jobs in their respective jurisdiction. And that is a wonderful source, because it typically is non-dilutive, meaning you don't have to give away anything. At this point, I think we have collected over 4 million euros in non-dilutive funding. And that, again, reduces the risk for the family office, but also increases the value of your company, right? If you value a company at €1 million or dollars, and now you have $1 million in public funding, this is non-dilutive, boom, suddenly you've doubled your company value without giving away any shares. Now, you as a CEO and founder, your job, and that again is my take, your job is to become a storyteller. And that sounds to a lot of engineers out there very unappealing. But the thing is, you need to convince people that you actually have what's called an equity story. And this equity story consists, amongst others, about your business case, your value proposition, and your growth story. And these things are very important. The business case is, how will you make money? We'll come to that in a second. But the problem is that if you cannot convincingly present to a venture capital company or an investor that you will make money, well, you're not going to get anywhere. And the problem is, yes, most people say, well, I'm going to sell my device or sell my software or sell my solution. Yes, but why would anyone give you money for it, right? And the problem is, you have a 4-field area where on the one dimension, you improve therapy or improve outcomes or improve the patient well-being. And on the other dimension, you have cost. Of course, on the top right, you have therapy becomes more expensive, but also better, right? But on the bottom right, you have your therapy becomes better and you're saving money. How is your value proposition in this field? Are you hopefully not making things worse? But there's also solutions where you decrease quality of care a little, but significantly decrease cost, for example. And that story, that equity story, that value proposition story, in combination with the question, how do I leverage upon this value proposition to my client? And how do I generate reliable growth? That's the equity story. And this equity story, I can tell you, when I look back at my 2014 slides, my neck hair stands up. It's a disaster. And even now, in three months ago, after over 7 years in this company, I rewrote our equity story again. So now when I stand on stage and tell people what I do, again, I'm presenting it from a slightly different angle. This will never end. I mean, like, if it does end for you early, then congratulations. But most people I know consistently improve upon their story. And had I known that, I would have probably much earlier taken advice on how to hone and shape in my equity story, because you only have a limited window of opportunity to present this to investors. So let's take 2 examples. What's your business case? Example 1 is we improve patient recovery by 20%. Example 2 is you tell the same story, same product, same everything, and say we reduce patient cost by $8,000. I think, I mean, like, I'm not even going to make this a question because I think it's very clear. But what you see is the world cares about money. And the question of what your business case is and what the value proposition behind is can be framed in very different ways, giving very different outcomes to the audience, although you're doing exactly the same thing. So the fact that venture capitalists care about money is, I think, pretty clear, right? But if you talk to hospital administrators in private, which I have done, then you will actually learn that, unfortunately, their top priority is also their cash flow and in the end, their profit and loss statement. Because you can do the best medicine. If you continue losing money, then at some point, whoever finances you will shut you down. So these guys also need to make money. So being able to present your business case on a financial side is crucial. And a lot of engineers, I'm an engineer myself, right? We're just not educated to do this, to think this way. So I can only encourage you to seek help. A few trends that I have observed over the last years. One thing that actually comes to the advantage of people who do a lot of hardware is this market 2 years ago, or even last year, was basically, if you said, I have a hardware component, you were out of the game if you were trying to fundraise. That does change because people realize that hardware is something that cannot be copied as easily as software and can be patented and therefore generates value. And I think, not to mention the last point, right now is probably the worst time point over the last 20 years to fundraise, right? Doesn't mean that it's not possible. It just means you have to have a much, much longer breath. So this is a very busy slide, but we'll go through it. And we're almost done with the presentation. Do's and don'ts. And again, this is completely personal. If you have other experiences, let's talk, right? So point number 1, know your buyer's universe. Someone once said to me, it's very, very easy to get into a company and it's painfully hard to get back out, right? If someone puts $500,000 euros, dollars, or whatever currency on the table, well, of course, you can invest. But getting your exit straight as an investor is terribly hard. So it helps a lot if to an investor, you can present not only how that person gets in, right, what conditions, etc., but also when and how they can get out. And that's when this value inflection topic comes back in, because you can say, with your money, I can reach that value inflection point. That means X, and that's how we get out. Second, in case you have never done this before, venture capitalists actually keep your deck. And when they tell you it's a little too early for us, come back when you have reached XY, and you can then come back. They will compare what you promised a year ago and what you have achieved. So don't overpromise. It's not worth it. Number 3, I think the de-risking I mentioned. Try to find the major risk. It's also something that I've found in my experience. People want to become CEOs. People want to found a company. And then they know that there is risks, but it's much more convenient to ignore the really, really, really big one in the middle, and you can just focus on something easier. The best advice I probably got in the very beginning of starting my company was try to kill it, right? The earlier you can kill your idea, the more time you can save on something that might already be dead on arrival. So de-risking means look in the mirror, be honest to yourself, and ask yourself what's the biggest risk there is, and focus on that. Point number 4 we spoke about. Public financing is very helpful in whatever jurisdiction you are. I promise you there is a large amount of public money. If you are in Europe, you can contact me. I can help you find some of it. Number 5, identify your value proposition. Have your equity story straight. And if necessary, pay an advisor to help you storytell, right? It's such a big difference. I mean, I'm very careful with statistics, but they say that 90% of any decision someone takes is emotional. Of course, you need to check your boxes. Does it have a chance? Does it serve a good market? Is the market big enough? Do I believe in the team? But even after checking all the boxes, that logic boxes, typical investor still can do one investment for every 5 or 10 investment targets they have. And then suddenly things become emotional. So if you can tell a compelling story and come across as someone who is emotionally connected to that person you talk to, then suddenly you can be ahead of the pack of the other 5 that also check all the boxes. Then number 6, keep your burn rate under control. If you do hardware as we do, it does take longer than you expect. And you've just seen the typical sales cycles and the typical value inflection cycles. So don't overspend your money on high salaries or bringing in expensive people until you really have enough money to support yourself and you can see the next value inflection point. Point number 7, take the hard decisions. Kill your company or your idea, or even kick out someone from your company that is standing in your way or that makes things harder for you. There's a book actually called The Hard Thing About Hard Things from Horowitz, the guy who has one of the most reputable VC funds in Silicon Valley. I can recommend that very much. Taking the hard decisions and not beating around the bush. Number 8, VCs care about money, right? I mean, like, that's the point. Don't promise. The point in most of the cases is you need to talk about money. I learned that in my pitch, the second sentence I say is, why would you care about what we do? Because we can reduce cost per patient by X. Oh, now you have their attention, right? If you say we can improve patient well-being, well, it's okay, nice, congratulations, we don't care. So build your network. I think that's also clear. Trusted introductions to venture capitalists are very valuable. Be fast. After 5 years, typically, your window of opportunity closes, and that's a personal experience. But venture capital companies don't want to work with companies that take too long. Point number 11, we already said about this. Talk about money, not about patient value, at least not to investors. Don't be shy to talk to them early, right? They will tell you if you're too early. They will tell you to come back once you have reached milestone X. But then at least they already know you and you can build that emotional connection. And I think the last point is very clear. I have talked to so many people in my life, and there's never shame in asking for help. And interestingly, most people really enjoy hearing themselves speak. So if you ask them for advice, they will be happy to talk to you, right? Who doesn't like to be perceived as an expert, right? Everyone does. So I have written to the craziest people, to CEOs up there, written them an email. Dear Mrs. X, do you please have 5 minutes for a coffee? You have no idea. I probably got a 90% success rate on that, just because people want to help other people. And finally, look if you can find case studies. To my knowledge, in our field of robotics in care, there's only one successful company that really raised money on a large scale, and that is Furry Intelligence. So if you can, try to understand their equity story. Try to understand what sets them apart from all the others. And with that, I think I'm already way over time, but I tried to compensate a little for the fact that Alan couldn't make it, and I'll stop here and be happy for your questions.
Thank you. Thank you so much, Dr. Koenig, for sharing these inspirational success stories that you have, your building blocks, literally Lego, and achieving the funding for and growth for your company. So it's a very informative and sharing the hard truths about funding sources.
Thanks again, Dr. Koenig, for sharing your insights and wisdom. And thanks to everyone in the audience for your time and attention as well. So now we'll be moving to the Q&A section of this panel. So I can see that we already have a few questions in the Q&A box, so we'll get through them one by one. So just to kickstart the Q&A session, I have a personal question on my own, just for Dr. Koenig. So knowing that you are a judge at an accelerator, I just want to pick your brain a bit. What do you look for in a startup? And what makes a company stand out to you as like a judge?
First of all, please say Alex. And second, that is a very tough question that really always depends. Alchemist Accelerator has the goal to really fund the next disruptive breakthrough. And what we looked for there in companies was companies where the alchemist can really provide value, right? With their network, with their know-how. Second, we wanted to see things that are a little crazy, but if they work, they can really go through the roof, right? So they were not looking at a 3x, yeah, we can do something, but they were looking for crazy things that can really change the world. And third, I think that's always super important is the team. They wanted to make sure that the people presenting there, they had the feeling that they could make this happen. Because the saying, a fantastic team will get a mediocre idea to success, but a mediocre team will probably screw up a fantastic idea. So team, value that the accelerator can bring, and finally the potential impact.
Thank you so much, Alex, if I may. So I think next we'll also have Brian, who asked, as founder of the company and with your engineering background, do your knowledge in financials and key metric of business matter much to a venture capitalist?
Very, very much so. I can tell you a story. And again, I'm full of stories. And I'm not sure if you can deduct any wisdom from it. I was with a venture capitalist and I had sent them our projections, and that VC wanted to argue our market size down, annual market size in Germany from, I think we were talking about 200 million annually, and he was convinced that it would be only 500,000 euros. So what do you say? You're like, no. And he says, yes. I say, no. He says, yes. You can play this until eternity, right? Fortunately, I had a very seasoned CFO as an advisor, and he helped me build a model. And now I sent this model to the venture capitalist, and now we can talk. Is the assumption X? Should you put this or this in there? Or you can say, but now you're discussing on facts. And suddenly we could settle that our market was at the minimum 100 million and not 500,000, as this person said, right? Why? Because you're discussing upon facts and not about, I have a feeling your market is small or big. So the financials are absolutely crucial. And if you can, then find an advisor in your network that can help you build recreatable, understandable models of your assumption. Because the only thing that someone in the end can say is, I don't believe your assumption. And you say, okay, do you believe that we should put a 10 instead of 100 in this Excel field? And then he says, well, maximum 10. Well, you put a 10 in and you have the numbers. But now you're discussing on a factual base. So if you do not have access to CFOs, there are actually a lot of them out there as advisors. There's also a lot of not so good ones out there, but there are networks, startup networks, for example, in every country, in every city that have access to these people.
Thank you, Alex. That's a very insightful way of thinking. So everyone, remember to look for your CFOs as well. I have another question as well coming from one of our attendees. So let's say you're starting up a company, a young budding entrepreneur from outside of Europe. Let's say, for example, in India. how would you advise them to start up the company? Because obviously the idea of relocating to a much more established region will be a tempting idea.
I must admit I have no experience with India, so I might not be the right person to answer this. I can try, but please take it with a grain of salt. I live in Munich. Munich has the third highest rent and one of the highest salaries in Europe. Horrible place to start a startup. You're paying yourself half to death in paying salaries, right? I'm here because of my family. So I still didn't relocate to a place where I can hire engineers for lower money. If you have the opportunity to have a team and you keep your burn rate low, then India might be a really fantastic point to start, right? If this is medical technology, then the question is, what is your target market? And oftentimes target markets are Anglo-Saxon countries, Australia, UK, USA, or Western European. So now what you can do is you can get advisors from these markets and maybe even focus, and that's a very tough decision, focus your initial market entry in these markets. There's nothing wrong with starting anywhere in the world, India or wherever you are. And I'm sure that India has a very good supportive network of incubators, of organizations that help you with funding and with building your company. Again, I think the important question is, what's the target, what's the market product match between what you build and where your ultimate market is? And I think then look for that market and start your clinical trials and your network building in that market. But stay in India if you're happy there, if you have a family there, because the last word on that, if you really want to start a company, trust me, it's going to be so much harder than you could ever imagine. And you need your family in the background to support you. Otherwise, it's going to be tough.
Thanks, Alex. So thanks for sharing about incubators, and I believe earlier you shared about team values as well. So Howard here actually asked, how when many investors consider, the team behind a startup, how important they are more so than the idea or the product. So could you share with us, some of the important skills or personalities that investors actually look behind the individuals of the startup team, so to help attract the investors' attention?
I'm not an investor, so I cannot speak for them. And also, I think there's a broad variety of different types of investors, as mentioned. Some look more for the quick return, some look for... That's very varied. My experience is that one thing people want to see in a team, and that is that the team is able to take advice and actually turn it into action. So I have met entrepreneurs who considered themselves to already know everything. I'm pretty sure that these guys still didn't raise money. And the fact to be a little humble and saying, hey, I'm willing to accept advice from the outside, that I think goes a long way. And then the second part is, as a team, you don't need to cover all your bases. It's impossible. We spoke about just 2 questions ago about a CFO. Most likely you are not able to hire a full-time CFO. And if you're early on, you shouldn't, right? Way too early. But identify your weaknesses and identify as a team where you're still lacking skill. As long as you're able to communicate that to an investor and say, hey, we do not have a head of clinical studies. We cannot afford a CFO as of today, but we are aware of it. And we know that this is the list of things that that person will do. This is the skill set we look for. At least then the VC or the vendor, the investor knows, yes, they are aware of, because nothing is an actual problem if you are aware of it and have enough time to conceive a strategy about it. Right? Things only become a problem if you have a blind eye somewhere, a blind spot, or if you're running out of time to conceive a solution. So over the time course of a company building, the required qualifications also change dramatically, right? You start with tech, then suddenly you need a lot of certification know-how, then suddenly you need a lot of clinical know-how. In the meantime, you need to build up your know-how about services, support, distribution, fulfillment. And then you also need to build the whole business side. So, but that comes consecutively. So I think the tech knowledge in the very beginning is the most important thing, and showing that you actually are aware of what's coming. I'm not sure that really helped you. I hope it did. And if not,
that's actually great.
Context.
That's actually great. Thank you so much, Alex. I have another question coming up as well. So one of our attendees asked, given a chance to go back and redo your company essentially from the ground up, what would you have done differently to speed up your business? Because as you shown us in the timeline frame, it took an average of about 10 to 15 years to reach to a business proven state. So is there any tips and tricks from your end that you learn now that you can apply back then?
Well, that's a tough one. I would have to think about that. I think the number one mistake that I can identify I've probably made two mistakes. I should have thought about clinical studies much, much, much earlier. And being able to actually start clinical studies very, very fast after the CE mark had happened. That would have been very advantageous. So I underestimated the amount of time and money and preparation it takes for these. And second, and I think that is the biggest mistake we have made, I would have taken much more time in structuring the equity story and understanding that I need to speak about money. Had I done that, I would have probably been able to raise more money faster. And nothing is worse than if you come into this fundraising cycle where the only thing you're doing is fundraising for several years in a row. And so really getting the equity story straight. And then only after I have that, then push up your burn rate. I would have probably done that.
Thanks, Alex. So yeah, I think we're increasingly seeing how important clinical studies are to companies' growth, especially in our field. It's all about proving the efficacy, and also the safety of the devices. So our next question is somebody who asked, about the future of technology. So whether is it more inclined to software or hardware? So I know that you mentioned that hardware is harder to copy, but would like to hear more elaboration on this matter, if you could.
Again, that is a very personal observation. There is such and such businesses. But what I've seen is a strong hardware focus, such as we have it, still is very difficult to fundraise because hardware just takes significantly longer to develop, to bring to the market. You have much, much more problems with distribution as compared to software, which if you provide it in the Apple Store, there is your distribution channel, right? I have seen over the last 2 years or 1.5 years in a variety of startup competitions that the winners were oftentimes companies that had a smaller hardware component with it, typically a sensor that could sense something that others couldn't, or an actuator, for example, a device that could draw blood or could administer medicine or something. But it was always very encapsulated, relatively small and manageable, and particularly in the sensor side was something that actually just, quote, just sensed data that was unavailable without it. And then the actual business case was built upon the data. But being able to sense information in a new way, sense additional information that's not available as of today, sense it in a cheaper, more convenient way, or even in a home setting rather than in a clinic, for example, that I think goes a long way right now. But the actual business case is then still built upon the insights on the data that these sensors can measure. Again, this is very personal just from seeing startup competitions. But I think it does make a lot of sense because software, to patent software is very, very tough. Software is a pure execution play, whereas patenting hardware is possible and even comparably easy. So I hope this helps you with it.
That was actually great. Thank you so much for sharing that insight. We have another question from Victor. So he asked, how do venture capitalists perform valuation for startups besides the commonly used discounted cash flow method, or even book value method as well, since you've gone through the thick of it as well?
Well, Turns out I actually know a few heads of M&A from investors or from companies, and I actually asked them the same question. So the discounted cash flow method is not applicable in most cases, particularly in the beginning. If you have a stable revenue and if you can conclusively and convincingly show that you will most likely generate the revenue that you are proposing, yes, then discounted cash flow is the standard method. But most startups sell a dream, right? You're selling an opportunity. You're selling a, hey, this could be. And that's upon which the valuation happens. So there is discounted cash flow. There's comparable companies. Companies such as PwC, PricewaterhouseCoopers, actually have tools because they have big databases of previous transactions and can try to find a comparable company. But all this is pure alchemy, to be honest. The value that is associated with your company is most likely the question: at what time point have you climbed up the value inflection point ladder to a point where you can sell this company? Pharma companies oftentimes are sold already before they reach the market and have administered it, have received FDA or CE clearance, right? Or in Germany, the equivalent, or in Europe, the equivalent for medication. Medical technology companies, in this fewest cases, are technology exits. They're most of the times, the exit happens once we have proven the clinical case. And now you can back compute and say, okay, how long will this take me? If this really works, what you're promising, what can be the market size you can address? And so you can compute that back. But any of these methods is alchemy. And now it comes back to your discounted cash flow. And now it comes back to the question on how did you predict what in 4 years down the road, how much money you will make? And now it comes back to the question, can you substantiate your assumption? If you just say, well, you know, this year we made 100,000, next year we will just double it every 5 years, right? That's not very convincing, right? Everyone can claim that. If you have a complex Excel model in which you model every country individually, you look at the big markets, how big is the market, what market share can I capture? And you can substantiate that, for example, with letters of intent, showing that that you already for next year have booked so and so much revenue. Then a venture capitalist will be much more willing to believe your claims, and then you can go back to discounted cash flow. So building a valid model that is convincible, that is done with the help of a CFO or a finance expert, that is probably your best shot. And if that's not the case, yeah, then look into a glass ball.
Thanks, Alex. I wish we all had that glass ball to answer that question. So thank you for all the questions so far. I believe we'll answer one last question. So Chunan says, hi, Alex. And he asked a really good question that I think can sum up kind of what all of us would like to hear from you. So how do you actually foresee the trend of fundraising for rehabilitation technology in the next 10 years?
Oh boy, I think that's something we should ask Zen from Fourier Intelligence. He probably knows this much better. I think that now with the advent of a much stronger data focus and the point at which slowly we're moving towards personalized medicine, I think that venture capital or fundraising will become easier in our field. However, my current take, I cannot look into the future, but I think still software plays which go into real world evidence data is where still, as of today, you have a relatively easy game. And I think that topic of personalization, of real world evidence, that is something where, at least from my point of view, right now, the future lies. You compare it to the car industry, right? The fear of car manufacturers is that they become commodity providers for cars. And you as a driver, you don't care if you sit in a Mercedes, BMW, Volkswagen, if it's a Chinese make, an American make. But what you care about is the software that runs it, right? And so my prediction would be that it will continue to look very, very software heavy towards personalized intervention. And that is where the fundraising will go to. But someone needs to produce the underlying commodity, the underlying hardware. If you can, I would focus probably on ideas that involve a certain amount of hardware but are relatively strongly software focused. And then again, study the case of Fourier intelligence. And I think that was a brilliant move by Zen and his team on how they have approached the funding market, successfully approached the funding market. I think that's where it's going to go.
Thank you. Thank you so much, Alex, for your time today, for sharing your insights and knowledge with us. I think it was thoroughly enjoyable, and we got so much insights and experience from you. So I believe we are almost out of time. So thank you all for your questions. And if you do have any further, please do email us, and we will send them to Alex for him to answer by email.
And if you find me on LinkedIn, say hello, connect. Happy to help you there.
So that concludes today's session. I'd like to thank everyone for joining us. We hope you all have enjoyed and learned a lot from our experts on today's panel. So for now, goodbye, stay safe, and we look forward to seeing you all next time. You can find the recording of today's session and our past sessions on our website. So feel free to send in your feedback again to our email, and we can help improve our sessions, and we can talk about topics that interest you.
Thanks, guys. Bye.
Bye. Thank you, Alex.
Bye.